Doctor-elect, given that we've just had elections. G'avi is the policy officer for the National LGBTI Health Alliance based in Sydney. Just seems to be, well, absolute font of knowledge and research and all sorts of things, as well as completing a PhD. A friend of mine once, with the driest sense of humour, said, if you ever get the chance to do a PhD, don't. G'avi's done it, and you're still alive.
Surprisingly.
So I'm going to throw to G'avi to talk about cisgenderism in medical settings. Welcome, G'avi Ansara.
Can people hear me? Yeah. Okay, great. So first I want to acknowledge the people who have taken care of this land, who are the custodians of this land for many generations and centuries. There's a lot of different peoples, plural. So I just like this picture because this is actually not from Geelong, this picture's from Ballarat. And it's a sign that's new, and it's sort of the sign is sort of this way of showing that there's different ways of understanding the land, and you've got it in 2 different languages, so it isn't just in English saying welcome, but it's actually in both languages, which I thought was really powerful. So welcome to all the different peoples, plural, that are very different from each other in many ways, but have shared an experience of colonisation. So thank you, and thank you to all the people who've come here, Tiwi Islands, Shepparton, you know, all kinds of places where I know it has been difficult for people for various logistical reasons. We're so honoured that you're here, and also I think for me as Senior Health Policy Officer at the Alliance, it's really powerful to know that there's people here in this room that I've been trying to sort of connect with and had difficulty, and then, oh, here they are, so thank you. I'm going to start out, I believe in something called the framing of reference, you know, where we start out, who are we comparing ourselves to. And this is an 8-year-old girl, she was assigned male, she's a girl. And I don't say but, because I don't think there's a contradiction there. And this is kind of where GASp is coming from. This is from an ABC interview. And Jazz said, it's okay to be different. People said, what is it like being a young trans girl? So Jazz said, it's okay to be different because it just matters who you are. It doesn't matter if you're different than anybody else. It just matters if you're having a good time and you like who you are. Totally different from the other models that we've talked about today, different from gender dysphoria and the DSM. So that's my frame of reference there, is Jazz. So we can start with her. Now today it's actually momentous. I submitted this 299-page thesis, and I've never actually, at Health and Difference I presented a really brief version of this, but not the whole thing, because I hadn't finished the analysis. This is the very first time that I'm presenting chapter 4 of my PhD, which will soon hopefully be in print. And this experiment, so some of you are more familiar with my analyses of professional literature and finding discriminatory ways of talking in that literature. This is not that, this is experiments. And I call this the people versus Prader. And you'll find out who Prader is in a moment. Evidence from 2 psychological experiments. And I've added the thesis submitted in there. So I'd just like people to take a moment to look at this image and just think about what you see. Just reflect to yourself. Is anyone brave enough to say what they see? Yep, in the back. Very brave, Tony.
Yeah, I see a family.
Okay, wonderful, a family. Anybody else?
It's going to be baptism, maybe?
A baptism, okay. You're not the first person to say that. Any, Bonnie?
I see a bunch of men standing around a little boy, or like a little child.
Okay, a bunch of men standing around with a child. Anybody else? In the back, it's Jeremy. Oh, what's it?
From this angle, to be honest, I think I can see a boob.
Okay, I think I see a boob. Okay. Did you have some?
I kind of look like it's breastfeeding.
All right. So what did you say? Could I just say in your words? What did you say? Yeah.
It kind of looks like he was breastfeeding.
It looks like
He.
It looks like he is breastfeeding. Great. So this is just sort of my quasi-experiment to tell you what happened. I had a friend of mine who's a clinical psychologist, and she had asked me, look, can you give me a classroom activity for my students? And they're about to be finishing their clinical doctorates in psychology. G'avi, you do lots of lecturing. What should I do? Because you like to be, I like to be very interactive with my students. I also teach in Poland in an English-speaking international psychology program that's combined with, got master's students in it and undergrads as well. So I had a lot of activities, and I said to her, you know what, there's this thing I want to see. Why don't you test this out? Show this picture, have them write in their clinical journals what they see. Don't reference anything in particular, but just show the image. And what do they see? Well, I want to tell you, over half of them said it was either a priest baptizing a baby or a baby with two heads. So baptism, that's not the first time I've heard that. The rest, almost everybody in the rest of the class said it's a man breastfeeding a baby. As you said, why is he breastfeeding? Well, let me tell you what you're actually looking at. This is Magdalena Ventura, very apt Tony. This is a family. Magdalena Ventura with her family. Magdalena Ventura is breastfeeding her baby. She actually had 3 children. This is just, and so it's interesting. She was, when this painting was painted, there's a bit of poetic license, artistic license, because she was actually 52 when this was painted. Her kids were long grown, but this was purposely done to emphasise the breast and the breastfeeding. And we've got the breast in central figure. I know for some of you are a bit farther back, so you can't really see it as well. Interesting enough, though, when Jeremy said, I think I see a breast, it's a boob. It's almost like, oh, maybe my eyes deceive me because I can't possibly be seeing that on someone with that face. So people's perceptions are, sort of common reaction to this. And her husband, Felicia Amici, is in the background. This painting is José de Ribera's La Mujer Barbuda, and that means the bearded woman. It was painted in 1631. At one point it was being shown in Museo del Prado in Madrid. Now, what's interesting about this picture is this a real person, and she is, almost nobody says that's a woman. So although we have this sort of way of thinking where we say, oh, you know what, people's real sex or gender is determined by genitals, it's actually not, because what we do when we look at these pictures is we've got a breast, we've got a stereotypical breastfeeding pose, and we go to the face. Oh, beard, oh, stereotypically quote-unquote male hairline, square jaw, oh, man breastfeeding a baby, right? So we don't even necessarily do what medical science thinks we do, right? Because we're not looking at genitals, and as we've heard today, genitals are being focused on. So that's sort of where I go with the people versus prey, that there seem to be different things going on. Now I want to show you this diagram. What does this look like to you? Penis, okay, what else? Anyone else? What?
So there's ovaries.
Looks like a penis. What are those weird things hanging around, right? What? It's what?
Ovaries.
Ovaries. Is that ovaries? Could be. So, there's a very phallic image there. Oh, look, you're right. That's a medical anatomical illustration of vagina, vulva, vaginal shaft, that was the language used, cervix and ovaries, this is sort of, if you go pre-1800s, or pre-1850s, most of the medical diagrams, and I'll just use this one as an example, really, you would think you're looking at quote-unquote male bodies when they're actually depicting female bodies, because there was what Thomas Lacour, who's a historian of science, says is a one-sex model. And in that model, a female is an imperfect male, but it wasn't a two-sex, opposite-sex system. So I'm not sort of recommending one or the other, but I'm saying they're two different ways of understanding certain bodies. And male and female, though nowadays people tend to think of it as opposites, these opposite bodies, we've got a lactating male. 1499 to 1546 is when this artist, Giulio Romano, lived. This is from Emblematic Figures, and this is clearly a lactating, quote-unquote, lactating man. So I'm just introducing a term. I'm not assuming anyone knows anything of these terms, so that's why I'm defining this term for you. The term ideology just basically means systems of meaning. The everyday language, gestures, images, and other things that can construct and reflect a system of meaning. Okay, and I'll show you what that means in a minute in visual. But it's basically the common sense of community. It's what maintains these social relations of power. These images define who we are and who gets read as normal or not normal. So what is cisgenderism, which I'm going to talk to you about, which is what I studied? Well, it's an ideology, meaning it is a system of meaning that's reflected in thought and practice. And it's a system of meaning that specifically treats as illegitimate or delegitimizes, meaning renders not legitimate, people's own ways of labelling or understanding their genders and their bodies. And I put the genders first because I don't think the body is any more necessarily authoritative than the gender, whereas nowadays people seem to think that. And it also treats a particular match between genders and bodies as being natural, healthy, or superior. So the word cis in cisgenderism, as in ism, as in sexism, heterosexism, etc., means on the same side. So this assumption that certain things have to line up in a particular way to be right, and that's why we normalise intersex babies' bodies to be on the same side as how people think they should line up. I'm going to get to that. It isn't just sexism directed at, quote, trans people, and it also is not about groups of people as in cisgender versus transgender, but it's a critique of that way of thinking. So it's fairly new in the literature. And it's not, it talks about a function rather than the intention. So it's not saying bad people, you know, you are phobic. It's saying, look, a lot of these things happen without any hostile intent, but yet they still function to delegitimize people. And it's not limited to quote-unquote trans, as in people who fall within that umbrella, but it also looks at how intersex people are affected by people who are disabled by society, and people from cultures where non-binary genders are recognised. For example, the Bugis people of southern Sulawesi, Indonesia, where there's 5 recognised genders. Okay, mull that one over. I'm not going to go over my past findings except to say that in one of my previous studies, the one people are usually more familiar with, we found that, you know, depending on what profession you're in, pathologizing cisgenderism was really associated with certain disciplinary affiliations, such as mental health professionals, and particularly those involved with gender clinics, were much more pathologizing, whereas in literature about young people's genders and gender-associated expression, didn't really find that as much. It was below the majority in a non-mental health profession literature. So that's just to say these things are ideology systems of meaning. That's why they're different in different contexts, so it doesn't function the same way everywhere. We've already talked about what is intersex, so I won't go into that today. I just had this here in case it wasn't covered. But intersex, as someone mentioned before, is the most widely preferred term, even by people who don't speak English as a native language. People in many countries using the word intersex to describe themselves, an intersex person, and many people consider this disorder of sex development terminology to be stigmatizing and find that it makes them hesitant to seek care, as we've already heard today. So, what are normal genitals? Well, views of, quote, normal genitals differ between medical professionals from different studies. And clinical decisions about genital surgery are influenced by physicians' own judgments about the naturalness, attractiveness, and personal preferences about what they think is society's ideals. People have talked about normalisation surgeries. So, just to give you now a graphical visual to pull this together. So, how many kinds of giraffes do we have there? How many different giraffes do we have? Okay, we've got 7 giraffes, right? We've got a green giraffe, a yellow giraffe, some of you might be colourblind, so I apologise, but we've got a green giraffe, a yellow giraffe, an orange giraffe, sort of weirdly, am I yellow, am I orange, when I'm sort of both giraffe. We've got a grey giraffe, silver depending, we've got a pink giraffe, we've got a blue giraffe, so there's 7 different giraffes. So if we're being scientific about it, quote-unquote scientific, we look at these 7 giraffes and we go, right, there's 7 giraffes, so let's give each of them a name, right? Well, here's what we do with science. So we take these 7 giraffes, and I'm like, okay, pink and blue giraffes, great. Well, the others, you're not real giraffes, like there's something wrong with you. I don't like your colours or whatever. So we're going to cross you out. So we're going to go from having 7 giraffes to having 2 giraffes. And those are the only giraffes that are seen as valid. Right? Everyone else's somehow needs to be changed to be like the other 2. Which is a bit difficult, because you know, if you're a grey giraffe, it's quite difficult to turn you into a pink giraffe. It's quite a mess with all the paint. So we do this with human bodies as well. So we've got 7 distinct variations of infant genitals. And we cross out 5 of them. Now we're left with 2. But we go beyond that. We actually put those 2 in a very particular order. Again, system of meaning, right? An ideology, a system of meaning. And there they go. And those 5 bodies in the middle, they're not valid, they're not real, there's something wrong with them, it's those 2 other bodies. Notice, by the way, they don't have to be positioned one on the left, one on the right, but that's how they are positioned. And that gets us to Prater's 1954 diagram, which is the most widely used image in the field of pediatric endocrinology to describe quote-unquote infant genital virilization, okay, which is used to promote normalizing surgeries on infant genitals. So what is cisgenderism visually? If the words are a bit complicated, it's basically cisgenderism is what gets you from that top image there, where you've got the 7 bodies, they're all different and none is sort of prioritised as being in an ordered system of meaning, to the one at the bottom, where you've got an ordered system of meaning telling you how to read these bodies. Notice that it's not text, it's just an image. Okay? You don't need words to do that. So cisgenderism has been found in research. I'm not going to talk too much about that. And surgical normalization, as Morgan and others have said, is still practiced today. 30 to 80% of intersex children undergo more than 1 surgery, and some have up to 5 surgeries. These surgeries often cause irreversible damage. They can lead to urinary incontinence, lack of sensation, inability to ever orgasm, which is quite serious. So again, this is Prater's model with the labels. There's the normal female, Prater's normal female, Prater's normal male, and then everyone in between just gets a description as being a stage of disorder pathology. So bye-bye, giraffes. You're not welcome here. So I took those bottom images, because the ones at the top are more complicated. Sometimes you would need to do some surgeries some of the time for medical reasons to help someone have bladder function. So they're more, it would be more complicated to explain. But for these external ones, there's no medically necessary reason why you should even touch them. So I took those images, and my first study is an experimental method. I took 37 undergraduate students, and I broke them into 3 different experimental conditions. There was a free sort condition, where I took each of the Prater's images, put it on a laminated card, had them face down, had them shuffle them, and then had them turn them over, and I gave them a verbal instruction. My verbal instruction contained an ideology. Okay, so I had 3 conditions. One of them where I said, children are born with many different kinds of bodies, sort these images in a way that makes sense to you, so that's my free sort. Okay, I have a binarizing condition where I said some children are male and others are female, sort these into those that are male and female. And then I had another pathologizing condition where I said some children's bodies are disordered and others are not, sort these images into those that are and are not disordered. Okay? And my dependent variables, meaning the things I was trying to see whether this experimental manipulation of framing would affect, were the surgical decisions people would make to recommend or reject surgery. And I used these Prater's images rather than photographs because the Prater's images are what are actually used by medical professionals today in terms of that model, that system of meaning. And I also looked at their confidence in their surgical decisions. So this is what a participant sheet would look like. So they turned the cards over, they shuffled, they sort of put them in an order that made sense to them. They labelled like which one was either male or female, which one was disordered, not disordered, or they created their own categories. And then they labelled things. And then I asked them a series of questions. So that's kind of how it looked. So what I found, now in the Prater's medical model, which is, again, still the one that's used today in the medical profession, all five of those bodies in the middle are recommended for surgery. So in this study, what people said, the average for people, I apologise for lack of italics here, but the average for people was 1.54. There's a huge difference between 1.54 and 5. There's statistically significant differences between what people said and what Prater said, which is really interesting when you get the medical professionals are justifying these normalising surgeries by saying, oh, well, parents won't be able to handle it, people won't be able to handle it, this isn't normal, people in the general world won't accept these people. No participants recommended surgery for all the bodies that would currently be surgically altered, okay, by medical model. But interestingly enough, my experimental condition of the verbal instruction didn't actually have a significant effect on people's recommendations for surgery, on their confidence in surgical decisions, or on the extent to which they thought each image fit the category to which they had assigned it. So there was something else going on. If the verbal instructions are not what's making the difference, then what else, right? So I thought, well, what about the way the images themselves are structured? What about the language we use to talk about the images in terms of actual text? So I did a second experiment. This had a wider range. My participants ranged from 18 to I think the oldest was like 62, so much wider range of people, variety of countries. And I looked at framing. I had again a free sort condition, but like I did in the other study where they shuffled the cards. But everyone got a pathologizing verbal instruction because I wanted to see how does the visual alter. You know, in other words, if there's a contrast between what I'm saying to you and what you're seeing, does that affect how you make your decisions? So I gave everyone the pathologizing instructions. Some children's bodies are disordered and others are not. Sort these into those that are and are not disordered, and then I would ask them later on. I would say sometimes medical professionals, sometimes surgeons operate on children's bodies to give them a more normal appearance. Which, if any, of these bodies do you think are in need of surgical intervention? Then I had them rate their confidence in their decision, etc. I also had them rate the category of fit, the extent to which they thought each image fit the category to which they'd assigned it. So I had the free sort, I had diagram only with the ordered image, and I had the diagram with the text. So right there, that was an example where I had put them in the order. So not like the first condition where they just free sorted the order of images, but this imposes that order. And then I also did another condition where I had the text plus the order. So I could separate out which effects were due to the ordering of images and which were due to the text. So first of all, Prater again classified all of these 5 bodies as disordered. Participants rated fewer images as disordered than Prater, and only 4 participants in this study rated as many as 4 or 5 images as disordered. Okay, so very few people in this sample. Now, only Prater stages 2 and 3 were categorized as disordered by a majority of participants. Sorry, am I going down? Okay, so here's this image here you can see, and this is basically for each image whether people thought the genitals were disordered or not, and whether they thought surgery was needed. And one of the things you can see that's quite interesting here is that even when people classify genitals as disordered, they don't necessarily recommend surgery. Okay? And I also found that people were less confident in their decisions when they recommended surgery, and more confident when they rejected it. So people weren't as comfortable agreeing to these procedures. Now this is how, these are the means, so the average, for how people responded in terms of the percentage of, this is the percentage of people who classified the bodies as disordered, depending on which group they were in. I'm sorry, there was a legend, but it appears to be cut off on the screen. So the darkest colour, the dark grey / black colour, is in the free sort condition, where I didn't have an experiment, particular ideology, but it was whatever they came in, whatever ideology they came into the experiment with. The second one, the lightest colour there, light grey, is the condition where it was just the diagram with no text, and the third one was the diagram with text. And you notice something interesting there is that for a lot of them, there was no difference between the ordering of the images and the addition of text. Okay, in a lot of them. In other words, it was really the differences were more striking between once you added the image into a particular order or a system of meaning, rather than actually using language about it. So we can debate intersex or DSD, which terminology to use, but beyond terminology, there's a separate thing we also need to be talking about, which is how the ordering of images or the visual representations can affect how we think about bodies. So the effects of visual framing that was quite striking is that 67%, so a majority, of participants in the free sort condition classified Prater's normal female as disordered. And in fact rated that image as disordered, more people rated it as disordered than they rated any of the Prater stage images as disordered. So look at that again. If you look at on the left, you see that you've got all the way on the left Prater's normal female. Notice I'm not calling it normal female, but Prater's normal female. And you see there 67% of people, and my participants were mostly women, by the way, say, and between 18 and 62, right, so not just young women, said, look, you know, that's a disordered body. That's the one people are being surgically normalised to have so they can fit in. And then as soon as you go to the light grey, the image, without any text, all of a sudden look at that shift, look at that dramatic shift. And notice that when we add text, there's no additional shift that happens, meaning it's all the ordering of images that's doing that. The nice thing about experiments is, unlike other sorts of studies where it's just correlation, right? That is associated with this, like when you have something high, the other thing is high. With experiments, you can actually look at causal relationships, or you can theorize about them. Obviously you need replication, but still. And Prader stage 4 had the most prominent changes from not disordered to disordered across conditions. So Prader stage 4 is that one there, is towards the right. So you can see almost a reverse effect, right? People start out, fewer people thinking it's disordered, and then when you add the text, shoots up. What's interesting there is that you see that there's no difference between the image without the text and the image in the order for that body, whereas for the Prader's normal female, you see there is a difference. So it doesn't play out the same way for all bodies. Now if I'm just taking these two, you can see again, that's almost a reverse effect. And one of the things I found is that people rated quote-unquote gynic bodies, meaning the bodies that were more on the left side of Prader's representation, so Prader's normal female and these other bodies, those bodies were more consistently rated as higher in disorder than the bodies to the right, the more phallic bodies. Okay, so as we get to increasingly phallic bodies, they're not rated as disordered to the same extent. So again, this is Prader's model. So we can see that it isn't just the text or the classification as disordered, which is what people have talked about, but it is in fact that visual representation of bodies that can change whether 67% of people think that Prader's normal female is a disordered body. Interestingly enough, that image, actually, the image of Prader's normal female is very close to the World Health Organization's image for genitals that have experienced female genital mutilation. There is no clitoris, there is visible clitoris, there is no visible clitoral hood, so in a sense it isn't normal. So that's an interesting thing about that. So to recap my results, the medical model considers more bodies disordered and recommends surgery for more genitals than lay people do. So there are differences. It's not just that medical professions are reflecting society's ideals as is often claimed by the psychosocial rationale. Even when lay people classify bodies as disordered, they often refuse surgery. They're not particularly confident when they recommend surgery either. And I think Bonnie had talked earlier about coercion and how people, you know, her feeling sort of pressured to say yes to surgery, or someone had talked about, I think it was Bonnie. And so visual framing can reduce pathologizing. In other words, if we take this Prader's normal female and we give you a visual representation where that body is presented in a spectrum where you're coming from a two-sex model and you go, oh, that's the normal body, let me find the normal bodies, they're on the ends, good, I'll judge the others against it, then isn't it also the case that we could reframe the other bodies so that they're also not considered disordered when people come into a situation thinking the bodies are disordered? So too, we could create our own new representations, right? Similarly, we can look at also how pathologizing the text increases pathologizing, because as we saw with the phallic image up here, Prader stage 4, once we add the text, now there's people who didn't think a body was disordered who are now thinking it's disordered. Okay, so it can go either way. So representation, framing, or framing effects in psychology, can have a significant difference. And I want to do more of these studies, but if we look at the implications of this, we can say when people talk about, we're talking at this two-day forum, we're talking about young people directed. You can see, is it centered on young people, youth, teenagers, children, whatever ages we're talking about, or is it directed by them? And the reason that's important is because I certainly wouldn't want to be altering someone's genitals permanently. We're talking before about, should we give people hormones that could change them permanently? Well, I certainly wouldn't want to be altering someone's genitals permanently for a medically unnecessary reason, that themselves. But similarly, I wouldn't want to force someone to go through the wrong puberty because they weren't directing it. There's also an ethnocentrism there, because some of these bodies are seen as perfectly fine in some cultures and not in others, particularly depending on the type of erotic imagery that people are exposed to about bodies in general, adult bodies. And there's a human rights angle there as well. And Jim Kostic, unfortunately I wasn't able to get his narrative off of my computer today, but he actually wasn't normalised and talked about how there was tremendous pressure by his parents to have him normalised, and he wasn't, and he grew up fine. As we know, we have a mayor in the room, former mayor, current councillor, Tony Griffer, who shows that people can be perfectly fine by not being messed with. So I'll give you a quote here, which is basically from the director of an organisation that's trying to end female genital mutilation, which is that it is time to recognise that the right to genital autonomy belongs to all children, regardless of race, culture or gender. And there's been a protest outside the Royal College of Surgeons in England when they were doing live demonstrations of these genital surgeries. And so when you think about what you can do, I think you can really think about how you represent things. What are the visual representations that you use in your professional practices? What kind of materials do you have? And not just look at language, but look at where images are placed and how they're depicted in relation to other images, as well as things like text. So there's a lot we can do, as we saw, to change how people see the world, to change the ideology or the systems of meaning. Thank you. Yes.
Are you taking questions?
Yes, I'm taking questions, sorry.
I just wondered if you had any comments on the impact of sexism and the portrayal of female bodies and pornography and all those results, because it's remarkable how much it's that side of the, on the female.
Yeah. I mean, it was interesting because after I did the analysis, I separated into gynec and phallic bodies, and the only body that wasn't in the category is the body dead centre in the middle, because most people of the participants had sort of judged that body to not fit in either of those categories, so I was going with how they classified it. So when I was contrasting the gynec images, the ratings of disorder and the ratings of recommending surgery, with those for phallic, there were real differences. And actually, part of what I've written about in my PhD is that has to do with the androcentric history of the field of paediatric endocrinology. For example, and I covered a lot of this stuff, which is quite interesting. So Lawson Wilkins, who's one of the founders of the field of paediatric endocrinology, originally wouldn't accept surgical fellows who were women because he felt it was inappropriate for women to be alone in a room examining the genitals of prepubescent or pubescent young men, or quote-unquote males, although those can be two different things that we know, but that was sort of his idea. No problem whatsoever with some of the things that we've heard today about people having, dilations or having, men surgeons, poking around and prodding and being with them alone. So there was this sort of, because also the people who were defining what a normal body looked like were, in the beginning, all men. That might be why Prater's normal female has no visible clitoris or clitoral hood. So that's great, and I think pornography does have something to do with that, but interesting enough, that construction of the body, that image, comes from 1954, when pornography was quite different, and there weren't as many easily available portrayals of genitals. It was before most people had the internet. So, on some senses, we can say that actually predates that. I think there is an effect now, certainly, where, in particular, quote-unquote female genitals are being more read through a lens of pathology than, in some ways, than male genitals. And they're being defined as sort of a lack of. You see in Prater's image, though, in 1954, Prater's defining it as a lack of. So increasing virilization. The more similar you are, in Prater's model, the more similar, quote-unquote, female genitals are to, quote-unquote, male genitals, right, his normal male, the more disordered they are. Whereas previously, you had people saying things like, vaginal shaft, and that was just a normal female body that was being evaluated against that androcentric norm. So what's interesting is that we moved from a vaginal shaft and a penile clitoris, exact terms being used, being perfectly normal ways to describe a body, to those being descriptions of Prater's stages of bodies Prater considers disordered. So historically this has shifted. I think when people talk about sex, like someone was born male or born female, I don't think they understand that this category, it's not just gender that's constructed, but these sex categories have shifted historically, and they are not the only way of understanding bodies. And I think the most powerful lesson that I've learned from my research is that cisgenderism is not inevitable. In other words, we don't have to represent bodies this way, and consequently we don't have to treat bodies this way. So if we're doing that, we have a choice to change that. And it may be slow, but we have a choice to start raising these questions and start trying to make a difference. Any more questions? No more questions. Okay. Thank you so much. Thank you.